Here I am again, out walking the dogs. We've been away for a week up in Norfolk, doing a lot more walking, I can tell you, doing some bird watching and all sorts of stuff like that. But what I thought I'd talk about today is asthma. There has been a lot of talk on the news about the really unfortunate deaths from faulty immune system, from the sesame seed in a baguette, all of this. And what you may not really appreciate is that we have the capability of actually treating asthma. We use a thing called interferential therapy, which is a low frequency current. It's been around in this country since 1949. It underwent a big revolution in the late 1970s, in fact when I was at Barts, and it was the engineers at Barts who designed the first British machines. We have been treating asthma with it. It is using frequencies that stimulate the immune system. The research is there. We know that it's a better bronchodilator than Ventolin, and I've really got to the stage now where I think I have to gather together 100 case studies for asthma to show the effect, the positive effect of interferential therapy on asthma. The longest I've had a patient go without an asthma attack now is 30 years. One of the latest ones is a young man who virtually every winter of his life ended up in hospital because of the acute asthma attack, and he's now gone through certainly one winter, and we're monitoring to see that he gets through basically the rest of his life without an asthma attack. It's interesting because there is a huge move now within the so-called bioelectronics movement, for want of a better word. The drug companies, or certain drug companies, are being funded with enormous IT companies to produce implants, indwelling small seed type things, set on different frequencies to stimulate the body or to control the nerves that do things within the body. And one of the key ones that they're looking at is using these implants for the treatment of asthma. And we've been able to do this for the last 40-50 years, but using external electrodes. Now, one of the biggest problems I have is that I'm a physiotherapist. I'm not a researcher. I'm not a medic. I am a physiotherapist with more years than I necessarily care to remember under my belt, but I know that interferential works. I probably know more about interferential therapy than anybody else in the world. I'm currently writing the second textbook, and I want to get this out there. So we're going to try and collect 100 single case studies that might then stimulate some researcher in a laboratory somewhere to say, hey, let's look at this. Can we produce a machine that is dedicated for the treatment of asthma and get rid of this problem? It is possible. I do need some money to do this, and we're looking at different avenues of doing that, but essentially I need 100 case studies to prove that it works, as I know it does. Walk the dogs the rest of the way. They're looking at me rather strangely at the moment, particularly this one down here. He's saying, where's his walk? Thank you very much. I will speak to you again soon. Have a good day.